Today we're here with Kristin Eggleston from Sunrise Midwifery. She has a new practice in Tri-Cities in the Yakima Valley area, providing complete prenatal and postpartum care, home birth, and well woman care. She's also having an open house in downtown Prosser on May 5th from 8 to 8 at 1126 Meade Avenue, and a cool new building they have there. So Kristin, perhaps you'd like to explain to us the advantages of using midwife services over those of hospital care?
Sure. There actually are many benefits for the type of women that midwives take care of, and the type of women that we take care of in pregnancy and birth are healthy women who are experiencing normal pregnancies. And so when you are taking care of someone who is healthy, you're supporting the normalcy and then referring her on as needed. Midwives have really low C-section rates, partially because we are taking care of women, healthy women having normal pregnancy. But the rates of the risks that come from the medication use and the interventions, the epidurals, the episiotomies, the continuous fetal monitoring, we avoid that because we take care of the mom differently. So
Kristin, what would happen if a woman did develop a complication during your care?
Well, that does happen sometimes, and what we do is we consult with or refer as necessary according to the problem that develops. As soon as we get past the normal parameters, we are talking with the people who deal with the outside of normal parameters.
So can you tell us a little bit about your training and then the licensing that goes along with being a midwife?
Both Lori and I were educated at midwifery schools and also completed clinical training in a variety of medical and midwifery settings. We've worked with doctors in their clinics and followed them at the hospital. We've worked with midwives in their birth centers or in their home birth practices. We've been at over 100 births apiece. A significant portion of them, we were the lead midwife, and there's just so many things that you learn in that number of births. And so really together we have over 4,000 hours of clinical training in both the medical and midwifery settings.
So Kristin, perhaps you could tell us a little bit about the safety of home birth and midwifery care.
Sure. Once again, when we're dealing with healthy women with normal pregnancies, the safety record is really quite impressive. And recent studies, both in the United States and in Europe, where midwifery care is highly used, it shows that midwives achieve the same sorts of rates of problems as what happens with the same type of women in the hospital. But yet we have very much lower rates of intervention and greater rates of maternal satisfaction. We also want people to realize that this is a very safe and effective and especially a cost-effective choice. And that's becoming much more important for many people, both the health effectiveness and the cost effectiveness. But there is a lot to be said for being at home or most midwives' offices are pretty, calm sorts of places, and we tend to work on our own, so we're not sharing big buildings with other people. And when you call the midwife, you get us. You don't get an answering service. You don't get a message that the doctor will call you back later, or you talk to your care provider basically at any time you call her, and even if it is 3 in the morning. Laura's just about 33 weeks pregnant, and so this week we're going to do just a regular checkup, measure her belly and make sure everything's growing normally and doing what it should be doing. We don't have to do much of anything today. I'm just checking her blood pressure, making sure everything is just doing what it ought to. It's a pretty simple thing, pregnancy. So we like to support the normal side of it. Are you feeling the baby move normally and everything?
Yeah.
Sorry, my hands are freezing.
Oh, that's okay.
Midwifery care. Oh, yeah. And so then the next thing that I'm doing is feeling for the position of the baby. And what this does is it just helps me, gives me an idea not only of the position, but also of the size.
But this must be so much more comfortable than having to pack up and head down to the doctor's office for a visit and all that. I mean, yeah. Laura looks totally relaxed and comfortable doing this. It's great.
Well, last week I got pancakes.
So Laura, you've obviously chosen to work with a midwife for your pregnancy and delivery. You want to tell us a little bit about what influenced your decision?
Well, I like to view birth as a natural process, and it's much easier to do with the midwife, and she comes to your house and really teaches you how to be self-sufficient and learn the baby's positioning and measuring your uterus and really learning about the birth and what's going on with your body on your own and how you directly affect your pregnancy versus a doctor's office where it's good that they're there if you need the extra help or if complications arise and they're not far away, and Kristin's easily able to refer you to those services, but it tends to be viewed more as a medical procedure and you don't learn how to do all of the things on your own, and it's just a very different experience, whereas through the midwifery model of care, I think birth can be a really empowering and family strengthening experience that you can have in your own home with the necessary people there to help you through that and make sure that everything goes as it should.
Mm-hmm. Well, it sounds like you really thought this through, and you know what you want, and you're making it happen, and I really admire that. So, good luck with your baby. I'm looking forward to meeting the little tyke.
Thank you.
Dan from idrinkyourwine.com. We're here today with Kristin Eggleston from Sunrise Midwifery, and some of her clients. This is little Ava, John, and Laura. And this is idrinkyourwine.com, so I guess we ought to drink a little wine, huh?
Go for it.
And today you brought a Chinook wine for us from Prosser. They're a great little winery in Prosser. It's a 2007 Cab Franc. I've had their wines for many, many years, actually. So let's pour. Oh, I just love that sound. There we go. Okay, there we go. You may have to go and catch a baby later. Who
I
knows?
might have to do that.
Okay. Well, today we're going to celebrate the upcoming Midwifery Day, which is May 5th, as I recall, and the opening of your new clinic in Prosser, which is going to be a great thing, great event. So here, cheers.
Cheers.
Here's to
Thanks,
happy, healthy babies and natural childbirth.
All right. Good job, Dan.
Oh, yeah.
Oh, this is yummy.
Yummy, very yummy. Well, it's a Chinook. Well, again, I'm Dan from idrinkyourwine.com. And remember, if you're buying, I'm drinking.